So hey everyone, my name is Ron. My name is Ronald Harris, and I go by Ron. I'm a senior organizer with the Health Justice Committee at the Northwest Bronx Community and Clergy Coalition. And right now, I'm here to just share a bunch of good information concerning health and a lot of spectrums that seem to we tend to forget about, but tend to affect us on our everyday life, as far as housing, as far as the great work that we're doing at the Armory to bring ownership to our community, so they can have benefit from this large development that's taking place in the Bronx, and it's a great development. I want you guys to learn a little bit more about that. But just an overview of our presentation, you're going to get to know who is Northwest Bronx, a little bit of our mission and values, our structures, like I said, our areas of work, community organizing, and we also have a wonderful weatherization program. And also, why is it important to have health justice in the Bronx? The Bronx is number 62 out of 62 counties with the worst health disparities in the Bronx. That's big. We're being heavily affected, and I'll get a little bit more about into that as we go along in the presentation. And we're going to end it off with some questions and answers. Again, this is a presentation, but I want to have some dialogue with you guys to actually have a conversation and talk about these things that are affecting our everyday life. Okay. So presentation goals. I want to introduce Northwest Bronx. We can align to improve health outcomes for Bronx residents like you all. We want to share, like I said, we want to share the key values. So the mission of Northwest Bronx. Who is Northwest Bronx? We're a coalition brought together with diverse people and institutions to fight for racial and economic justice through integrational organizing to transform the Bronx and beyond. And our vision, we envision a Bronx where our people have all the essentials for our community to thrive, including housing, education, and work with dignity, as well as personal and environmental health. And we are rooted in collective ownership and decision-making over our political, economic, and social systems, in order to build a just, equitable, and sustainable world. And, our mission and value are important. They serve a foundation for our activities and align with our values and principles. Our key values, we do this work because we love our community. Those directly impacted should be guiding this work. Your experiences is enough to develop solutions. We are committed to shifting this current power structure and building collective power here in the Bronx. We value pride and dignity and believe that the diversity of our community should be celebrated and is a strength. We strengthen our numbers because we value equity. We envision a community where those have been marginalized or given what they need to thrive, be happy, and also be happy. Our areas of work, community organizing campaigns. You guys have a handout. And I'm sorry for the folks that's on Zoom. I will be linking all these flyers in the chat at the end of this, so you can have access to this as well. This is a list of all our campaigns that we're working on. Who here is familiar with the New York Health Act? What do you know about the New York Health Act?
Okay. It is something that's been on the horizon for a number of years. And the goal is to provide affordable health care for all, regardless of, putting insurances by the wayside.
Mm-hmm.
And for all to be able to access.
So the problem is, like I stated earlier, the Bronx is number 62 on health outcomes. Undocumented communities are left out of health coverage across the state. On average, 50% of New Yorkers with health insurance will still struggle to access healthcare due to costs and insurer-imposed barriers. Insurance companies make New Yorkers ration care. They are unnecessary middlemen. These making lives difficult for doctors and patients. Insurance companies is making doctors overwhelmed. We've been working on a number of campaigns, the End Medical Debt campaign, as well as the New York Campaign for Help. And what we learned through that is doctors need help. They are overwhelmed, and patients are being affected by this. The community is being affected by this. So it's important to pass this New York Health Act, which is a universal, comprehensive, single-payer bill that will guarantee health care for all New Yorkers. It will provide care that covers all medical care, which will reduce the cost for 90% of New Yorkers. And we are fighting for this bill because it's important and it's what the community is asking for. That's why it's important for us to educate one another on the importance of this and why we need it, because we are being affected. Our health is at stake, and we are being played with these insurance companies and by these hospitals. So yes, we also fight on housing bills. We're fighting. Who's familiar with the TOPA bills? Who's familiar with TOPA? Tenant Opportunity to Purchase Act. Okay. Who's familiar with the whole rundown with the landlords keep selling the building with their friends, and they keep in the building in the same decrepit building, no repairs being done. They keep that same rotation, that same landlord with their friends. What the TOPA does, give the tenants the opportunity to have a seat at the table, and they have a chance to be first at the table when the building is being offered for sale. So this is a perfect opportunity for tenants to get involved and take ownership of their building. If you want to learn more, I'm happy to link you with the housing organizer after this presentation to learn a little bit more about that. And we also focusing on youth, because youth is important, and they're going to be guiding this work leading forward. It's a S&S campaign, Schools Not Suspensions. There's a school to prison pipeline that's really affecting our young ones. They're being just criminalized and at a very young age, suspended for up to 180 days. That's a half a year in school for minor things. So this is something that is important, and it's affecting our youth, and we're really working double time on that so we can overturn that and, focus on guiding our youth and giving them what's the word I'm looking for? Positive outcome. Thank you. Because without positive outcome, you got to get to the root cause of what's causing these issues with the youth and deal with the root causes. And with the root cause, we found out is housing is usually the cause. Health is usually the cause, and it's down to the parents. You got to deal with these root causes. If you don't deal with the root cause, you're going to just putting a Band-Aid over a bleeding cut when you need to do full-blown surgery on it. You need to tackle it at the root, and that's what we're doing with the school to prison pipeline. We're tackling these issues at the root to make sure our youth is moving forward with their right head on their shoulders. And of course, the Health Justice Committee, and also the Armory campaign. Who's familiar with the Kingsbridge Armory? I called you already. What you know about the Kingsbridge Armory? What do you know so far about the Kingsbridge Armory?
The Kingsbridge Armory is owned by the government, and was vacated. We used that it was meant to have, and that the last, I'm not totally up to date on it, but the last information on that is supposed to be a developer coming in to develop that property. And that community is getting very active in advocating for community involvement.
You was right on the money with that. So yes, it was a big development plan, but that plan fell through because the developers wasn't able to get the funds, and the whole project fell through. So we're working double time to make sure we still have the small businesses involved that's surrounding the Kingsbridge Armory involved in the Armory, and making sure that the community get their vision into the Armory, so that we won't have this big thing that's not benefiting us in the community and also taking away from the small businesses that's been there since day one.
Can I speak a little bit more about that? Yeah, okay. I just let me ask my questions. I envisioned it the way I understood it would be, I'm gonna say, a collective for various nonprofits to use that space, or am I off base on that? So,
Let me ask you to use the mic when you
sorry.
speak, because otherwise the Zoom folks can't hear us at all.
You're correct that nonprofits would be engaged in using the armory because the community would want that. But right now, what Ron is sharing is because that the developer didn't work, that we are working now, and there will be a bid for people to propose how to use the armory. It is the largest armory, I believe, in the world, but we know in the United States. So it's going to have multi-use. The prior developer was having ice skating rinks and, you know, some type of entertainment. But this development that the community has been articulating has been for multi-use, which would include some type of educational, some type, just what you said, space for the community to use, some type of space, as Ron said, for small businesses to engage and to be able to use it. It's important to have training, as Ron has said, just to bring it. The truth of the matter is to bring wealth to the community.
Thank you, Roberta. So yes, that's also taking place. We actually had our last workshop, I believe, 3 weeks ago to wrap up all the decisions and input from the community so we can put it into a package deal so we can move forward from there. So that work is still taking place as we speak, and it's due to the work from the community that we're going to have our input. You know, it's through you guys' voices in the community that whatever you say you want in that building is going to be in that development. So moving along, we also have a weatherization assistance program. It targets energy savings improvements for income and eligible one-to-one family members in apartment buildings. So what they do is they get a contract, and they will be able to retrofit or weatherize a whole development. From down to windows. Who's familiar with that big fire that took place on Twins Park Towers? That's because the building wasn't weatherized. It wasn't weather stripped. So and the doors was left open. So it was a lot of health, safety hazards. So the fire swept because there was no closing of the door, and the oxygen levels was shooting through the building, creating a high rate of fire. What the weatherization does is they put weatherization strip downs on the door to weatherize the building, improve windows, lighting systems, and in the Fort Independence development, they actually installed HVAC systems, converted from non-conventional AC and heat to conventional AC thermostats, using thermostats in their development. So that was a big project, and they're also working on a new boiler. It was a big issue with their boiler blowing out, and they have to have an outside unit boiler to provide heat and hot water. There was a lot of loss of heat and hot water in the coldest conditions. This was taking place. So through organizing, that took place, and they're moving on up and getting these improvements that they need. Why is it important to have to organize health in the Bronx? Sure.
Well, health anywhere should be a universal right. That is my belief. So whether it be the Bronx or anywhere, but right now in the Bronx, everybody should be guaranteed health. So important.
Healthcare is important. Health is important. Health
Everybody should be guaranteed that they can access and affordability. And if you can't afford it, it should still be there.
Mm-hmm.
It's like an inalienable right. I mean, as far as I'm concerned.
Everyone should have a right to guaranteed health care. That is a human right. Housing is a human right. Health is a human right. These two are root causes that affect our everyday life.
And education.
And education. Can't forget that. Cannot forget that. Is this that?
Gotta work.
Yeah.
In your life.
On the slide here, I'm sorry for you guys in the room that can't see, but on the slide, I have the percent level of poverty that's taking place in the Bronx. We are the highest rate of poverty. We have the highest rate of diabetes deaths in the Bronx. We have the highest rate of AIDS death in the Bronx. We have the highest rate of asthma hospitalizations in the Bronx. We have highest rate of hospitalizations for drug use as well, and also infant deaths. All that is taking place right here in the Bronx.
Infant deaths in the Bronx.
Infants are dying, babies are dying right here in the Bronx.
Imagine maternal mortality is
It's high. That's another, that's included in the
Do you
percentage.
have a breakdown by neighborhood?
It's not a breakdown by neighborhood. What it is a breakdown of the Bronx in different sections. It's color coded. Different counties. I'm sorry, different counties are color coded. Yeah. So by the rate, the high rate.
Study done by Robert Wood Johnson every single year. And the Bronx has been number 62.
Last on the
They've been
list.
doing the study in New York State. It has not moved up
Mm-hmm.
in terms of all the other counties, and there are only 62 counties in New York State.
Can I ask why is that? Why is that?
That's why I would like to look at that, to drill down to sections, because you've got disparities of wealth and income, and I don't know where Riverdale sits versus Norwood, Mount Haven, Soundview, and
A big disparity.
Yeah.
There's a big disparity.
and what are the resources, what's the analysis, as you sit and look at, why is that?
Mm-hmm. But you're right on track with the power mapping. It's down to resources. How is the money being divided? Who's getting what?
Well, the other in terms of, you said, why is that? And in terms of the waste processing plants that, and things like that have been placed in the poor neighborhood because the powers that be could control.
And you have to ask yourself, why is it the Bronx that they dump waste? You have to ask yourself, why do they choose the Bronx for the location to dump that in your backyard? Why?
Or do they choose certain areas of the Bronx?
Lack of power?
She said that. I heard you say lack of power.
Certain areas of the Bronx,
Mm-hmm.
Right.
not Riverdale.
No.
For many years, as you well know, until we had people going in and organizing and helping the poor, well, I'm gonna say it's just straight out, that to have a voice,
Mhm.
get together and recognize that when we come together, we have power, we can, but for many years, that was not the case. From my perspective, anyway, from my knowledge.
Mm-hmm.
I see that there's been a change that in the way that community has come to the gardening, and the food, the food supply in South Bronx, so it actually changes.
Transportation, and what's available within each community for healthcare, for schools, for getting from point A to point B.
Mm-hmm. And why don't we have access to clean, healthy food?
That's
Why when we go into the grocery store, everything's expensive and you got to go to a Whole Foods for actually, in the Bronx, my grocery store right across the street from my house, it's always browning vegetables, browning lettuce, broccoli. You got 2 days before you need to cook it. Why is that? Why don't we have access to healthy foods? And we are getting all the shipment of trucks with all these produce in the Bronx. We're getting all the exhaust. We're getting all the asthma, and we're not getting all the benefits. Why is that? We need to start asking ourselves why things are this way and why we don't have the resources we don't have. Moving on to the next slide. And
It's all political, right?
it's all political. And we need to realize we're all in the same boat. We are in this together, and together we can get to the other side of this, you know. Majority of the Bronx is suffering. Only 2 households poverty rates below the city average in 2019. Riverdale, Fieldston, Kingsbridge, and Co-op City, Pelham Bay, and 6 registered poverty rates among the 10 highest citywide. I'm sorry, again, this is a graph I want you guys to see.
Is that going to be available to us?
Yes, I actually...
It'll be in the recording.
It'll be in the recording, and also if Joan would like to share it with you, she can. She has access to that.
Which senator or congressman or can we get to that he will make a difference?
The speaker is stopping this up. If we put pressure on Carl Hasties, he's the speaker, and he's pretty much holding the New York Health Act up.
Does he want to help?
He says he support the bill, but instead of supporting the bill, we need them actually to bring it to a vote. Instead of saying yes, yes, yes behind doors, we need it to be on
He
paper.
doesn't say yes.
It's the UFT. Let's be clear. Let's be clear. UFT and DC 37 have pressured our elected officials to not bring it to a vote. Michael Mosley, who is in charge of UFT, has ended, I'm sorry. Michael Mowgli, who's in charge of UFT, and UFT publishes or implies that if we have the New York Health Act, it will cost too much money. Now, there have been studies that have demonstrated this is not true. So they are working right now. Senator Gustavo, who's New York State, who happens to be our senator right now with the redistricting, is working with the unions, and Assemblywoman Paulin, who's just taken over health also. So they're trying to work with the unions to get an agreement. Because if you recall, if any of you are union orientated, unions have been using in this country healthcare as a bargain versus wages. But if you took healthcare out of the picture, then we would be talking about improving your work environment. Just recently, all of the city retirees, because of the unions agreeing, are now no longer under Medicare. They had to go to Medicare Advantage. Again, it's the unions that are having the power, that are impacting our government, because we know our government runs on money. But our congressman, the only full congressman for the Bronx, the full one, is Richie Torres. And he happens to be our congressperson.
What you're saying is, I mean, I'm a retired teacher, and we are angry that we are being forced into this Medicare Advantage.
Oh, I'm agreeing, but it's our union. My husband happens to be UFT, so that's where I get my benefits, so that's why I've been following it. And he's retired. But I'm just saying that, but it doesn't matter that we demonstrated it, because when you talk about power, what they did is, right now, what they're offering you is the same. So they said, okay, don't complain because you're gonna get the same.
But it is not the same.
Well, wait, right. Well, what I'm saying, on paper, it's the same now, but let's see what happens a year from now and a year from there.
Not the same even now.
It's not the same. I mean, they're saying
They're telling us it's the same.
people get the same benefits, but it will cost less, which is ridiculous, because that's not how it's gonna work.
And I think we could get into that for another meeting.
No, these are all good questions.
But I'm surprised that the UFT is against helping people who don't have health care, because it costs too much. It doesn't make sense.
But it doesn't cost too much, that's the
Well,
That's the narrative they're
I
creating.
don't understand that they're backing that.
It benefits somebody, it benefits the insurance companies. I'm a therapist and I've had patients who say, oh, I'm gonna get this new insurance. And then they had to stop seeing because they got enormous bills.
Yes.
Even though I'm covered for Medicare and for United Healthcare, somehow this plan was out of it. So it must benefit the insurance companies, you know, to have this. I mean, they have such power. And anyway, we'll get into that later. I have other questions about fascist ideas about not helping people that aren't like you. What I wanted to say though, in this space, maybe this month is another group called Indivisibles, that they had a grassroots social action kind of political group.
Yes.
Anyway, they had a program, you know, for our elected officials to speak, and Gustavo Rivera was here, and Jeffrey Dinowitz, and both of them were supporting the New York Health Act. And you said also Richie Torres is.
Well, the Richie Torres is congressperson.
He's Congress. Forget that. And I think we're going down almost the same. And when we're digressing too much, I think we need to go back to it.
Yeah, I just wanted to add, the last that I looked into it, one of the challenges in getting the act passed is that while after, I think it's 4 or 5 years, it starts getting cheaper, for the first few years, there's an increased expense. And so that makes a weakness in it that's easy to attack, because it will look at first like it costs more, even though it's only 3 to 5 years before it is actually cheaper and recovering all those increased costs from the beginning. But in times when raising your taxes or paying more for anything has a really bad reputation, it is a weakness that we have to overcome with other support of the act and saying we need to bite the bullet, we need to get that done, so that in the long term, we, our children, our grandchildren will be better off.
Thank you, Joan. And this slide is accumulation, as a breakdown of boroughs of accumulation cases, hospitalizations, and deaths from COVID-19 through May 16, 2021. And the Bronx had the highest death rates. We had the highest hospitalization rates. We had the highest case rates. And we was almost tied with the cases in general. But the Bronx is being affected the most. There is a healthcare crisis taking place here in New York State. Despite the increase in coverage since passage of the Affordable Care Act, more than 1 million New Yorkers remain uninsured. When the federal public health insurance declaration ends in May, more than 1 million New Yorkers may lose their Medicaid coverage. A 2019 survey found that 52% of New Yorkers find healthcare unaffordable. 3 out of 4 New York adults said that they were worried or very worried about affordable healthcare in the future. There's also a medical debt crisis. Medical debt is a crisis nationally, and is in New York, 1 in 10 U.S. adults have Medicaid debt. Rates are higher for Black adults, people in poor health, and people with disabilities. As of June 2021, U.S. Americans had $88 billion of medical debt on the Consumer Credit reports. By far, medical debt is the most common form of medical debt. For third-party debt collections, 58% versus 15% for the next highest. A 2019 poll found out 50% of New Yorkers used up all or most of their savings on medical bills. That ain't right. That ain't right. Who here knew New York hospitals sue patients? Who here knew New York hospitals sue patients? Yep.
Yes.
Yep. New York hospitals, which is all nonprofit, mind you, have sued 53,000 New Yorkers between 2015 and 2020. The median lawsuit is from $1,900. Most lawsuits are won by default. Many hospitals never sue at all. New York hospitals receive $1.1 billion in state indigent care pool funds to support uncompensated care. Hospitals are required to offer financial assistance up to 300% FPL, which is FPL to take ICP funds, by they regularly don't comply.
Can I just stop 1 second for that? Just to put in perspective, I'm so sorry. Just to put in perspective, 300% of the income that he's describing, a family of 4 earning around $83,000 should be able to apply for this hospital finance. So think about how many people you know that earn $83,000 and is a family of 4. And they should be able to get assistance in hospital bills. I just want to put that.
Thank you,
I
Robert.
think it's important for you to put that
In perspective, yeah.
You know, think about teachers. You know.
Thank you, Roberta. What are some of the consequences of medical debt? What are some consequences? Bankruptcy, homelessness, divorce.
Break down a family.
Right.
Can't address your health, your ongoing or debt.
Eh,
Can't get access to it.
Mm.
Your medical debt, still not making an influence on assumption. You're pretty dumb sick. You're pretty sick.
Yeah, you're pretty darn sick. All that, there's liens on your homes, there's wage garnishments, affect your credit score, your credit report is affected, your mental and physical health is affected. You know, these are the major consequences of having some medical debt.
Dropping out of school.
Dropping out of school, that could be a large stress, lead on to some depression, you know. And now we're going to get into some local, statewide, and national work that we're doing here in Northwest Bronx on the Health Justice team. Locally, we're on a Montefiore Bronx Accountability Coalition to monitor the Montefiore divestment of services that's taking place in the Bronx. Who's here familiar about the Montefiore closing on the Grand Concourse? Vaguely. Well, what they did was consolidate 3 clinics into 2 clinics. You know, how do you think that would affect patients? How do you think that would affect doctors? Overcrowded. So, I'm sorry? Access. So think of that times 2. They was already experiencing that at the Grand Concourse. They didn't increase the staff. So what they did was move all those patients and doctors to the 1F Fordham and also to the Williamsbridge Clinic. And they're still experiencing patients in the hallway, on gurneys in the hallway, extremely long wait times. Staff having to travel. Imagine you're a regular doctor here at Grand Concourse, right across the street from your home. Now you have to travel all the way to Williamsbridge, and you know your health is already is not the best. You know, transportation may be hard for you. So you take all those things into effect, and you have to travel and schedule new transportation. And they did promise shuttles, but I don't see no shuttles till this day to transport.
You worked at that clinic, now you, as an employee, had to go travel further. You really had a tight schedule with dropping your kids off at school already. Now how are you gonna manage to, so there's so many domino effects to this that don't affect the patients directly, but it affects the people who are providing the care.
Mm-hmm.
And you're providing care and you're tired and you're exhausted and
You're right on the money. You're right on the money. It's a domino effect. Thank you for that term. It's a domino effect that's lead down from the doctors, the patients, and affecting the overall community.
Yeah, well, just to say, I used to work at Fort Tremont Community Mental Health Center
we can, I mean, our caseloads were enormous at times, and such a stress, and the patients were waiting in the waiting room, and, it just, totally to your point, I mean, it's a stress on the whole system. It's really bad.
Everybody's stressed out, so that took place, and we put together a coalition along with Mekong and Mekong NYC, and along with other organizations and doctors and patients to really monitor that and make sure the Montefiore residents and patients is receiving the care that they need and the resources that they need. It's an ongoing fight. It's still taking place till this day. Other local work we're doing, we're a part of the Bronx-wide plan and support of the Health Buildings Initiative generated by the Bronx-wide Coalition, a group of community, faith, and labor organizations from across the Bronx. You want to talk a little bit more about that?
Bronx-wide. I'm sorry, give me the mic.
Be helpful if anybody who speaks, if you just ask for a mic.
So maybe I hold it and just.
Yeah.
Okay. So the Bronx-wide plan and the Bronx-wide coalition, as Ron mentioned, is a wide variety of coalitions and churches from the East Bronx to the South Bronx. And we're developing a plan which is addressing economic democracy. And by doing that, what we're talking about is when I was mentioning wealth. So the Armory is part of the plan, perfect example. We want any type of development. We're talking about union wages. And I'm sure we've been hearing about the importance of unions and making sure people are getting paid correctly. And we know that from Rutgers University. I'm just throwing it out that. We also are developing things that it's a wide variety. So I am going to give you information. We're going to make sure you have information about how you can look at these proposals. This is the middle of April, but we have proposals that we are supporting, such as capping the Cross Bronx Expressway. That impacts the Bronx. Vertical farming, possibly, or garden farm. So there's many proposals, but the purpose of why it's a Bronx-wide plan goes back to your point of power, getting everybody's voices together. And when I say it's Bronx-wide, I live in Riverdale, but we all are impacted. One is just as you started off with, we're all being human, but also we all benefit because we don't want to be in cages or be gated. We want to feel that we can walk throughout the entire Bronx and feel safe. And that's why we all should be involved and want to be supportive of a Bronx-wide plan to make our borough better. And even if you're a homeowner, if all of the Bronx increases, your value increases. So we all benefit. But anyway, that's the Bronx-wide plan. And when he mentioned an organization, Mekong, which happens to be Southeast Asian, not Southeast Asian, Cambodian and Vietnamese. It's an organization that they are still needing help, and they've put together. We have Lao, which are women from Bangladesh. We have churches. We have a youth church. We have a church in Northeast Bronx, Bethany. I'm going to say it wrong. I'm just not going to say the church name right. I'm sorry. But there's a church there. We have, I think it's South Bronx Unite. So besides Northwest Bronx. So I'm just saying there's a lot in the coalition and besides that. And the only thing I want to give you, I have to give a plug. We had our first public meeting on May 5th. That was a Wednesday. At that public meeting.
You mean April?
April, right. April, right. We're going to have one in May. But that meeting, we had over 100 people. It was in the Y in the South Bronx. Besides having over 100 people there, AOC, because she has part of the Bronx, stopped by to encourage people to participate because it goes back to what you're saying, power and voices. So that's why it's important that you all know that this exists, because we need your power and your voices.
Thank you, Roberta.
I'm sorry, I know. I'm sorry to take this one.
No, this is great. This is great. And also, we're moving on to the statewide work. We discussed the campaign for New York Health, advocated for passage of the New York Health Act and the New York State bringing the single-payer universal health care to New York State. And also, we are working on the End Medical Debt campaign, which is the Ounce Prevention Act, which is this handout you guys have there. This act updates the New York's Hospital Financial Assistance Law, it's HFAL, to make it easier for uninsured patients to apply for discounts so their bills do not end up in collections. Pretty much all the information is here. If you need it, and where's this? And also I provided the How to Cover Your Medical Bills guide for patients as well. You guys have that as well. So that's the End Medical Debt campaign. Now our national work, we're a part of the Care of a Cause campaign, is a national grassroots campaign founded by People's Action to address the problem of health insurance stopping people from getting the treatment they need or refusing to pay for the treatments people have already received, okay? Where's that flyer? Who here have ever been denied, have had a claim denied by their insurance company? Right now, we're fighting against claims and we're pretty much fighting back against these insurance companies and getting folks information, their claims, and we're fighting back with lawyers with appeals. All right, we're connecting you folks to People's Action. They have resources to, fight these appeals. And on this flyer, it has a breakdown of all the stuff you would need to contact me, to have all your information ready so we can get you prepared and ready to fight this claim. We only have a short timeline to fight the claim once you received it via email or phone call, whenever or however you receive that claim denial. We have 30, 60, or 180 days to fight that claim denial. So it's best if we jump right on top of that. At the bottom of this flyer, there's a QR code. You can scan this with your phone. It pulls up a survey, and you can give your name, your number, and a brief description of your claim denial, and if you're willing to connect and fight this claim denial, and it will connect you to me, and I will get your information and connect you to Ryan and People's Action so we can get the process started. I also left a bunch of these flyers you can take home, pass them around to your friends and family, take as much as you like. Everything is for you guys to take home with you guys and share, because you need to share this information as much as possible. All right. Actions you can take right now. You may see these little postcards on your chair. These are the petitions we're using to fight back against our elected officials and let them know this is what our community wants. It's important that we have this New York Health Act passed, and this is what we want. So we're going to put this on paper and bring it to your front step. Roberta, you want to talk about how we delivered these postcards?
So last year in April, we went up to Albany and we had big baskets. We had over 10,000, and we divided it and we delivered it to the speaker and to the Senate lead, majority lead. So it's important because it's giving them something physical. So your card is representing a person. So we are collecting those cards, and we're going to continue to collect it. We will not deliver it this year because the bill, as we shared, is being shaped, and we're hoping we can convince UFT and other people to support it so that it gets done. But Northwest Bronx, right now we personally have over, I think we have close to 2,000, but we feel that to be meaningful, we would like to see something like 5,000. So we really are trying just 5,000 unique people that are saying, I would like universal health care. So this is, I think that people have to be trusting as opposed to trying to think that you can regulate how the health care can go forward. I think what we're asking people to say in this is that you really believe, one, healthcare is a human right, that we know from this world that universal healthcare has put much better results than what has happened in the United States. Now, this is just statistically. Outcomes in other countries comparable to us, health-wise, are better. And those countries have universal health. Now, we're not saying that we're going for the same universal health maybe that they have. We're going for single payer. So that means that what we're suggesting is that we are saying, let's eliminate the insurance company that's adding no value.
So where do we send the stuff?
We don't want you to send the cards anywhere. We are collecting these cards, so we need you to complete the card. We put it in a database with name, address, and then we can know who your elected official is. Because to mail the cards individually is not meaningful. That's what I'm saying. We had these big baskets of cards that we gave.
But who, can you put where you put the name?
Don't leave it blank.
You'll put the right name in there.
Right, you don't need to put the blank in.
And the Albany trip is a good experience. The actual postcard drop off, it was a good experience for our leaders to see the actual dropping of the postcard at the office, the rally. We marched, we had good food, and it was a good ride back in the bus back over to the Bronx. So it was a good experience. If you would like to be a part of the Albany trips, we can connect you to, events that we possibly holding in the future.
How did they respond to all the postcards?
Okay, okay, now that you asked the question, the Assembly accepted our cards. They allowed us, they received the cards. The Senate majority, for some reason, their office was very negative and would not take the cards. Now, they were putting cards under the door.
We were shoving it through the doors, shoving it in the cracks. It was awesome.
You just don't know who you're dealing with every day. Now, we have been up, we did a rally in May, and we were at Hasty's office, and they spoke and listened to us, and we also spoke at Stuart Cousins' office, and they speak. So they speak, but you see, you have to be realistic. It is not, I wish we could say it's the individual elected official. There is so much power in our elections and in our politics that it is not, I can speak to you, there are very few politicians that can afford to stand on what they really believe. But we, the people, have to make them stand on what they believe by the fear that they will get voted out if they don't. And that's the power that we have as a group. But I think it's very important for us to see, and the elected officials rely on us coming there and pushing them. And I don't know if you remember, but most powerful elected officials ask, what do the people want? And those are the people, and that's why we have to voice our opinion.
That's our time to step in. I said, so that's our time to step in. Yes. And also, let's help us find others who have been denied care or support the campaign by, canvassing with us. We have canvassing events. We do tabling. We do phone calls. We also do trainings. You can be a part of a training to learn how to engage the community, how to be more involved in the campaign, how to push the campaign forward. So we do provide trainings if you'd like to be a part of a future training. I'm actually planning a workshop now. This is going to be a 2-part workshop of how to do op-eds and how to engage with press. So if you would like to be a part of that, that's in the making now, and I can connect you in that. And help us get candidates and elected officials on our level. It's the community that's being affected. So let's put the right pressure and right amount of pressure on these elected officials to support our bills. And if you're familiar with social media, I'm not going to put too much on you, but if you are, familiar with social media, please spread the word about these campaigns. Use hashtag, if you're familiar with hashtags, care over cost, New York Health Act, to get this word out. We have to get these campaigns out.
Why don't you put it in the Riverdale Press?
Helen Krimp, if you know, has written and was published in the Riverdale Press about the New York Health Act. So we are.
When was this? I don't.
So I'm just saying that recently. So I'm saying there are editorials. So we push that.
And the Facebook, Riverdale Facebook page. Are you able to post there?
We're on the Riverdale Facebook page. I'm sure that she has. I'm saying that she has done editorials. So that's why he's saying that to get it in, you have to get your editorial published. So we are engaging in that. And as you mentioned, we partner a lot with Northwest Bronx Indivisible.